Hi, this is Dr. A with your Intro to U.S. Healthcare lesson based on the 5th edition of Niles's Basics of the U.S. Healthcare System. We are going over the government's role in the U.S. healthcare, and this third and last part is going to be over the state and local health departments. So your state health department's role in healthcare is to monitor the communities to identify health problems. So I'll give you an example is in our state a few years back, in our area, little region, really, there was an outbreak of hepatitis A. And the reason we knew it was an outbreak is because the cases that happened at different hospitals and things were being reported to the state health department. And then they saw an uptick in cases and then coordinated with the health officials in the area. And they then coordinated a response that was then, of course, done at our local area in our different counties. The state health department helps develop policies to support community health, and so these are policies that could be different from state to state depending on the different communities and the health issues that they face. They are also to enforce laws and regulations that promote health and safety, so they can do health and safety inspections and daycares and restaurants and things like that. They are responsible for or share responsibility for federal programs that are related to maternal and infant health services and cancer prevention. And so each state is in charge of improving their maternal and infant health services and statistics. They also collect health statistics, and so these can be, data like obesity rates, but also there are a certain amount of certain diseases are trackable, also instances of different diseases, so if they're diagnosed with type 2 diabetes or cardiovascular disease, etc. So these health statistics are collected and reported, and so this is where we get some of the nationwide statistics, is because they are collected state by state and then sent to the CDC. They also license healthcare professionals. So if you are in a healthcare profession, which most do, that requires a license, then once you have finished your program and then pass your licensing boards, the results are sent to, you have to actually ask for the results to be sent to your state's health department, and you need to apply for a state license to practice that particular profession. There could be nursing, could be doctor, could be physical therapy, could be so many different things. And they also license healthcare facilities, so they will come and inspect hospitals and clinics and things, and just make sure that everything is going according to all the rules and regulations that promote health and safety as a workplace, but also for the patients. Your local health department's role, they're the ones who give the most direct services to the population. So they have the clinics and the locations where people go to, sometimes even to request some of the services that are done at the state level. And so over 90% of the local health departments provide immunizations to adults and children. And so often that is where they will send you to get your children's, vaccinations on schedule. Over 90% offer communicable or infectious disease surveillance. So, for example, if you did have health insurance coverage and you were worried about having an STD or an STI, you could go to a local health department and they could test you and screen you for diseases. Especially things that are spread. Over 80% offer also TB screening, and 75% offer TB treatment. So this is, again, to increase access for the populations that need it, and this is a population health also issue. Over 75% offer environmental surveillance, so water quality and things like that. Approximately 70% offer population nutrition services. So these are programs, for example, like WIC, Women, Infant, and Children, where new moms can go with the babies and they can have access to formula, or if they're breastfeeding, to different groceries and things. And so this can help with nutrition of the children, and the infant and then the children. Nearly 75% provide school daycare center inspection, and approximately 75% provide food safety education. And also they will do some of the inspections at the restaurants and stuff. There are 2,800 local health departments across the United States. They're often located in counties, so they're often at the county level. But some of them might be regional. So in conclusion for our Chapter 3 on the government's role, the federal government plays an important role in the quality of the U.S. healthcare system, and it provides funding for state and local government programs. Federal healthcare regulations are implemented and enforced at the state and local levels, and there are kind of like the minimum standards. And funding is primarily distributed from the federal government to the states, and then the state governments allocate funding to their local health departments. So your local health departments provide the majority of the services to their constituents. More local health departments are working with local organizations such as schools and physicians to increase their ability to provide education and prevention services, to increase their reach and their zone of service. So that's it. So I know it's not a lot. I've kept it really general because I imagine you guys that are listening might be in different states, and so you have to know that each state is going to do things a little bit differently, but they're going to try everything that they do is going to be there to meet the needs of their population at their different localities. So so that wraps up Chapter 3 of Niles, and so this was on the government's role in providing health care. The next chapter will be on public health.